origin, insertion, and actions. The trapezius muscle is a large triangular paired muscle located on the posterior aspect of the neck and thorax. As we can see, it originates from the spinal vertebrae. It is common to label three parts of the trapezius. The upper trapezius, also called the descending part, originates, proximal attachments, from the external occipital protuberance and the medial third of the superior nuchal line, spinous processes of C1 through C6. The middle fibers, also called the transverse part, originate from spinous processes and the supraspinous ligaments of vertebrae C7 through T3. And the lower fibers, also called the descending part, originate from spinous processes and the supraspinous ligaments of vertebrae T4 through T12. The insertion, distal attachment, of the lower fibers is the medial part of the spine of the scapula. The middle fibers insert at the lateral part of the spine of the scapula and the acromion. The upper fibers insert anteriorly in the lateral third of the clavicle. Its innervation comes from the motor spinal part of the accessory nerve 11 and the anterior rami of spinal nerve C3 through C4 via cervical plexus. The actions of the trapezius muscle are scapular adduction, elevation, upward rotation, and depression. Because the upper fibers originate from the cervical spine and the occiput, they can also create cervical extension. Also, the trapezius humeral rhythm and helps raise the arm by assisting in upward rotation. To strengthen the middle trapezius, utilize scapular retraction exercises